Squamous cell carcinoma is the topic, and we'll abbreviate this SCC. And essentially, squamous cell carcinoma is a malignant tumor of the skin. And essentially what happens is that the epidermal cells, when they have this malignant transformation, they invade the dermis, which lies beneath. And I'll give you some key distinctions between this and another type of skin cancers, but it's the second most common SCC. Second most common type of skin cancer. The most common, number one, is basal cell. But basal cell cancer presents a little bit differently. So here are some characteristic details about SCC. The first thing that you look for is a non-healing lesion. A person's had the skin lesion and it just doesn't seem to be getting better. In fact, it actually gets worse with time. Another thing that you look for that's a key factor is that the lesion appears on some part of the body that has exposure to the sun. And in terms of the way it looks, it's kind of variable, but some of the ways to describe it is a plaque, sometimes with scales. You can call it scaly or crusted. And I'll show you a picture during the clinical vignettes. And then eventually the tumor, or the skin lesion, ulcerates and invades the underlying tissue. And that's a very important part of the presentation of this skin cancer. So how do you actually diagnose this other than the clinical presentation? How do you know if somebody comes in and they have a lesion that it actually is squamous cell carcinoma? Well, without a doubt, the most important thing is the biopsy. And the biopsy will show the type of cells and confirm that this actually is a malignant tumor of the epidermal cells. And if it's caught early and it's small, then the prognosis is excellent. But unfortunately, if it's a late stage disease, then it's likely to metastasize. Even skin cancers can metastasize. A lot of people don't think that about skin cancers. And if that's the case, then it can, over the course of time, 5-year survival rate is only 34%. So as you can see, even a skin cancer can cause mortality in a large number of patients if it's not identified early. The treatment, there's several types of surgical techniques, and they're called destructive techniques. And essentially, one of the most common one is just the basic surgical excision. But there's others as well. Cryosurgery, local chemotherapy, curettage, electrodissection, all kinds of destructive techniques. But bottom line is it's that surgically removed. And sometimes radiation is used if it's a very aggressive type of skin cancer. So let's finally take a look at a picture of this. So this is a classic photo of squamous cell carcinoma. As you can see, it's in the lower lip area, the vermilion border, which is the area that a woman would apply the lipstick, in case you're wondering what the vermilion border is. And there's a clinical vignette associated with this, so let's take a look. A 58-year-old man comes to the office because of a lesion of the lip, which is shown above. The patient says that he has had this lesion for about 9 months. He has not seen a physician for 5 years, and he's in the office today only because my wife made me come. On physical exam, the lower lip is fixed to the anterior aspect of the mandible. The most likely diagnosis is. Well, this is a very characteristic presentation of squamous cell carcinoma, lower lip, and the way it looks as well. But there's one word that really screams out at me, and that's fixed. That's very characteristic, that if the lip is being fixed to the surrounding tissues, that's also very characteristic of squamous cell carcinoma. So the answer is E. This is the #1 most common cause of skin cancer, but basal cell carcinomas appear pearly. And I encourage you to look up pictures of basal cell carcinoma so you can kind of differentiate between the two. And the next one, a blonde, blue-eyed 69-year-old sailor has a non-healing, indolent 1.5 centimeter ulcer on the lower lip, arising from the vermilion border. The ulcer has been present and growing for the past 8 months. He is a pipe smoker, but has no history of alcohol or drug abuse. Physical exam shows weather-beaten facial skin, but no other ulcers. There is no enlarged lymph nodes in his neck. Which of the following is most likely diagnosis? Well, the location of the skin lesion and the history are classic for squamous cell carcinoma. They are telling you that he's out in the sun indirectly, that he's a sailor, that he has weather-beaten facial skin, kind of to imply that this man spends a lot of time in the sun. And there's no doubt that this is squamous cell carcinoma.